Have you ever encountered the notion that an excess of something beneficial can lead to negative consequences? Today, we delve into a topic that countless individuals engage with daily, often without a moment's reflection. Garlic. Indeed, the petite yet potent bulb that resides in our kitchens, makes an appearance in our soups, and even sneaks into our vitamins and supplements. You've likely come across all the wonderful benefits of garlic. It is inherent. It is beneficial for well-being. It is beneficial for the heart, and that is indeed accurate. Garlic has established itself as one of nature's most potent ingredients, yet there is a crucial aspect that many people overlook. Garlic, particularly when consumed in significant quantities or used as a supplement, may lead to serious side effects. For older individuals, particularly those in their 60s, 70s, or beyond, the risks can escalate significantly if we do not exercise caution. Rest assured. This video is intended to inform, not to frighten you. This is designed to provide you with a comprehensive understanding, as you have the right to be informed about both the advantages and the potential drawbacks, particularly regarding your well-being. In just a few moments, we will delve into the concealed risks associated with garlic. Aspects your physician may overlook, details seldom found on supplement packaging, and factors that could significantly impact your health, your prescriptions, and your everyday vitality. By the end of this video, you will possess the insight to make informed, secure choices regarding your use of garlic in daily life, free from fear, confusion, and without sacrificing the things you cherish. Let's get started. The reasons behind our collective affection for garlic are clear and well-deserved. Let's begin with the positive update. Garlic truly stands out as one of nature's most extraordinary ingredients. For centuries, it has traversed cultures and continents, serving not just as a culinary spice but also as a natural remedy for the body, and with good reason. Garlic has the potential to bolster the immune system. This suggests it could aid in our recovery from colds or infections more swiftly. Additionally, it may aid in lowering cholesterol levels and enhancing cardiovascular health. Certain individuals utilize it to assist in controlling blood pressure or overseeing blood sugar levels. Some individuals use it to alleviate inflammation or combat detrimental bacteria. This substance is abundant in compounds such as allicin, thought to be the key to its numerous potent health benefits. For those of us who are a bit older, garlic seems like a wonderfully natural option. We've witnessed countless trends rise and fall, but garlic? It has endured through the ages. However, this is the moment to take a step back and reflect. While garlic is indeed natural and offers many benefits, it is important to recognize that it may not be suitable for everyone, particularly as we grow older. Our bodies inevitably change from 35 to 70, revealing the undeniable truth of aging. The manner in which we break down food, the method by which we take in nutrients, and even how our liver and kidneys handle various substances, all undergo transformations. When we introduce medications into the equation, the situation becomes even more intricate. Before we explore the risks, I want to ensure clarity. This video does not aim to place blame on garlic. It is essential to honor it, as garlic is potent medicine, and potent medicine must be treated with caution. For those who incorporate garlic into their daily routine, whether through meals, supplements, or raw consumption, the following information is particularly significant. Let's delve deeper into the interplay between garlic, the aging process, and medication. One significant risk is that it may lower your blood pressure excessively. Garlic is renowned for its potential to reduce blood pressure levels. For numerous individuals, this is viewed as an advantage, particularly for those who are susceptible to elevated blood pressure or cardiovascular conditions. However, there lies the issue. If you are currently using medications like lisinopril, amlodipine, or metoprolol to control your blood pressure, incorporating garlic may amplify the effects of these treatments. At first glance, that may seem appealing, but in truth, it can excessively reduce your blood pressure. When blood pressure falls to a dangerously low level, it can lead to sensations of dizziness, lightheadedness, or even fainting. For seniors, a fall resulting from low blood pressure can be quite serious and, in some cases, even life-threatening. This holds particular significance if you consume garlic supplements or incorporate substantial quantities of raw garlic into your daily diet. If you're using medication to manage your blood pressure, it's important to consult your doctor before incorporating garlic into your daily regimen. Natural remedies hold great potential, yet they can become overly potent when combined with incompatible elements. Another significant concern is that it heightens your chances of experiencing bleeding. Garlic acts as a natural agent for thinning the blood. It functions in a manner akin to medications such as aspirin or warfarin, which inhibit the blood from clotting too rapidly. For certain individuals, that is a positive outcome. It may lower the chances of developing blood clots or experiencing strokes. However, for some individuals, particularly those currently on blood thinners, incorporating garlic into their regimen may pose risks. The blend may lead to excessively thin blood, heightening the chances of bruising, nosebleeds, or internal bleeding. This goes beyond mere supplements. Incorporating a generous amount of garlic into your meals consistently can lead to this outcome. When preparing for surgery, even minor procedures like dental work, it is common for medical professionals to recommend discontinuing garlic consumption at least 7 days in advance to prevent any potential complications. Numerous individuals believe that since garlic is a natural substance, it inherently poses no risks. Nature possesses a formidable strength, and in matters of bleeding, caution is essential, particularly as we age. Beware of the third danger: it has the potential to disturb your stomach. Have you ever experienced that uncomfortable bloating or heartburn after indulging in a meal rich with garlic? You're in good company. Garlic, particularly when consumed raw or in significant quantities, has the potential to irritate the stomach lining. Some individuals might experience indigestion, gas, cramping, or even diarrhea. As we grow older, our digestive systems often become increasingly delicate. Our production of stomach acid decreases, the movement of our intestines slows down, and we frequently use medications that can further impact digestion. Garlic can be particularly intense on an empty stomach, so if you consume it first thing in the morning as a supplement, you may be inadvertently exacerbating the situation. For some, preparing garlic may alleviate the irritation, though this isn't always the case. Should you experience stomach discomfort following meals that contain garlic, it's important to heed that signal. Your body has a message for you. While garlic offers health benefits, it can pose challenges, particularly for a maturing digestive system. Risk number 4, it has the potential to interact with your medications. This represents a critical danger that must be comprehended. Garlic influences more than just your physical being. Your medications may also be affected by this change. Garlic supplements, specifically, have demonstrated interactions with medications prescribed for HIV, various cholesterol treatments, blood pressure medications, and even diabetes drugs. These interactions may diminish the effectiveness of your medications or amplify their side effects. For instance, garlic can accelerate the liver's processing of medication, leading to its rapid elimination from the body before it has had the opportunity to take effect. Alternatively, it may hinder the process, leading to an accumulation of the medication to potentially hazardous levels. This poses a significant risk, particularly for those who are on multiple prescriptions, a common scenario among older adults. The greater the number of medications you are on, the higher the likelihood that garlic may cause interference. It's important to inform your doctor or pharmacist if you regularly use garlic, even if it's only as a supplement. A seemingly minor decision can have a significant impact on your safety. Risk number 5, it has the potential to excessively reduce blood sugar levels. Garlic is frequently lauded for its potential to assist in regulating blood sugar levels. That can be beneficial, particularly for individuals managing type 2 diabetes. However, there is a worry. If you are currently on medication to manage your blood sugar levels, like metformin, glipizide, or insulin, incorporating garlic could potentially lead to excessively low blood sugar levels. This condition is known as hypoglycemia, and it is quite significant. It may result in tremors, lightheadedness, perspiration, impaired vision, or potentially losing consciousness. For seniors living independently, a sudden decline in blood sugar can pose significant risks if assistance is not readily available. Many individuals consume garlic supplements under the impression that they will aid in managing diabetes, unaware that they may be inadvertently increasing their medication dosage. When overseeing your blood sugar levels with dietary choices and medication, exercise caution with garlic. Continue using it, but ensure your doctor is informed about your usage. Harmony and mindfulness are essential for safeguarding your well-being. Risk number 6. It may lead to digestive unease. It often comes as a surprise to many older adults that a common ingredient like garlic can become increasingly difficult to digest as the years go by. In our youth, our digestive systems are quite adept at managing a variety of spices and raw foods. Yet, as time passes, transformations occur. Garlic, particularly when consumed raw or in significant amounts, may cause irritation to the stomach lining, resulting in issues such as bloating, cramping, nausea, or diarrhea. Even when cooked, garlic can lead to discomfort for those who are sensitive. While you may not notice it immediately, if you experience stomach issues following meals that contain garlic, it could be something to reflect on. Individuals experiencing acid reflux or irritable bowel syndrome are particularly susceptible. Moreover, if you are on medications that influence digestion, such as antacids or specific heart medications, garlic could potentially exacerbate those effects. Pay close attention to what your body is telling you. If your stomach has a strong reaction to garlic, consider cutting back on its use or consulting your doctor for safer alternatives to incorporate it into your dishes. Hazard number 7. It may lead to intense body odor and unpleasant breath. Many are familiar with the phenomenon of garlic breath, yet few understand the duration of its persistence and the profound impact it can have on one's confidence and sense of ease. Garlic is rich in sulfur compounds, and these compounds don't remain confined to your mouth. They infiltrate your bloodstream, traverse your body, and ultimately emerge through your skin. Garlic can lead to a distinct body odor, particularly when consumed in significant quantities or used consistently as a supplement. For older individuals who might already be sensitive about alterations in their looks or well-being, this type of scent can create unease in social settings. It might become apparent that no level of brushing or mouthwash can genuinely eliminate it. Increased perspiration, whether from medication, menopause, or the natural progression of age, can amplify the impact significantly. Body odor is a natural occurrence, yet it holds significance for us as it influences our comfort in public settings and in the presence of those we cherish. Consider the impact of garlic on your aroma and make necessary adjustments. Risk number 8. It has the potential to disrupt surgical procedures and impede the healing of wounds. This is a frequently underestimated risk associated with garlic, particularly for older individuals who are more prone to surgical procedures, be it a hip replacement, cataract surgery, or even standard dental work. Garlic influences the clotting process of your blood. Before undergoing surgery, it is common for your doctor to advise you to discontinue the use of blood thinners such as aspirin or warfarin to minimize the risk of excessive bleeding. However, numerous individuals overlook the fact that garlic functions in a comparable manner. Consuming garlic regularly or using garlic supplements could potentially slow down your body's clotting process during or after surgical procedures. Such situations can result in issues such as excessive bleeding, bruising, or prolonged healing, and the risks extend beyond the confines of the operating room. It persists throughout the recovery phase. A minor cut or wound might require more time to heal, and there may be an increased chance of infection. It's important to inform your doctor or surgeon if you regularly consume garlic, particularly prior to any planned procedure. It is wiser to prioritize safety over unexpected outcomes. Beware of danger number 9. Garlic has the potential to provoke migraines or headaches. For certain individuals, particularly seniors, garlic transcends being merely a tasty addition. It has the potential to induce migraines or intense headaches. This may be unexpected, as garlic is frequently lauded for its numerous health advantages. However, certain studies and individual accounts indicate that garlic, especially when consumed raw or in large quantities, may influence the blood vessels in the brain, possibly resulting in severe headaches. Migraines transcend the experience of ordinary headaches. These episodes frequently present with feelings of nausea, heightened sensitivity to light or sound, and an overwhelming urge to rest in a dimly lit space. For some, the discomfort arrives swiftly, often just minutes after consuming garlic. Some may not see the link until they begin monitoring their meals and observe a recurring theme. Garlic often lurks in a variety of foods such as sauces, salad dressings, and prepared meals, making it easy to overlook the connection. Should you find yourself plagued by frequent headaches or migraines, particularly following meals, it may be worth your while to eliminate garlic from your diet temporarily. Consider maintaining a food journal to monitor your symptoms. Concentrated supplements might trigger reactions more readily than garlic incorporated into culinary practices. Consulting your doctor is the wisest course of action if you think a certain food might be impacting your well-being. In reality, each person's body reacts in its own unique way. Garlic can be beneficial for many, but if it causes you discomfort, it's perfectly fine to steer clear of it. Your comfort and well-being are important, and the initial step towards feeling better is to start observing your feelings. Peril number 10. Garlic may lead to digestive issues and persistent nausea. Garlic is recognized for its robust flavor, yet for certain older individuals, it also introduces an unwelcome aspect. Issues with digestion. With consistent intake, particularly of raw or concentrated garlic, one may experience symptoms such as bloating, gas, stomach discomfort, and potentially prolonged nausea. Although these effects may appear insignificant initially, they can intensify and impact your overall quality of life. With the passage of time, our digestive system tends to grow increasingly delicate. The lining of the stomach becomes thinner, acid levels decrease, and numerous individuals consume medications that further strain the digestive process. Incorporating garlic into the equation, especially in the form of pills or oils, may exacerbate stomach irritation. Some individuals experience unease immediately following a meal. Some experience discomfort for extended periods. Frequent occurrences of this can diminish your appetite, influence your mood, or even lead you to steer clear of food entirely. The challenging aspect is that garlic often doesn't appear to be the clear culprit. It's an ingredient so prevalent that many might overlook it, yet if you experience frequent stomach discomfort after meals, particularly those featuring garlic, it could be beneficial to see how your body reacts in its absence. Consider eliminating garlic from your dishes for a week or two. If your stomach is feeling better, you might have discovered the solution. Indulging in a meal should leave you with a sense of satisfaction and well-being. If garlic is hindering that, despite being natural, it may be wise to consider a pause. Pay attention to what your body is telling you. It's more insightful than you realize. A true tale and a soft nudge to reflect. I want to recount a genuine tale, one that has lingered in my memory. Robert, now enjoying his retirement, resides in the sunny state of Arizona after a fulfilling career as an electrician. At 72 years old, he takes great pride in his independence and continues to handle most of his yard work on his own. Several years back, he began incorporating garlic supplements into his routine after discovering online that they might aid in reducing cholesterol levels. He thought it was a natural thing to do, and it wouldn't cause any harm. Initially, all appeared to be in order. He experienced a sense of satisfaction in knowing he was engaging in something beneficial for his well-being. One day, as he was carefully pruning his rose bushes, he inadvertently grazed his hand against a thorn. It was merely a minor cut, something he would typically disregard. Yet, on this occasion, the flow of blood persisted. Neither after 10 minutes nor after 30. His spouse ultimately needed to take him to urgent care. The physician inquired about the medications that Robert was currently using. Avoid blood thinners and aspirin. However, he was consuming garlic daily in the form of pills. The physician elaborated that garlic has the ability to thin the blood and, for certain individuals, it may be overly effective. Robert was taken aback. He had received no prior word on that matter. Not the shop assistant who sold him the supplement. It wasn't the piece he encountered on the internet. Not a single detail on the bottle's label. At present, Robert continues to take pleasure in garlic. He employs it with restraint. He continues to tend to his yard, albeit with gloves on. He consistently informs his doctor about every supplement he consumes, regardless of how innocuous it might appear. I share Robert's story not to instill fear, but to emphasize the uniqueness of your body. As we grow older, even well-known items such as garlic can produce surprising outcomes. In matters of health, every detail holds significance. If you've been incorporating garlic into your daily routine or using it more liberally in your cooking, it may be wise to take a moment to consider your approach. Are you experiencing any side effects? Are your medications performing effectively? These are the types of inquiries that truly deserve attention. Not due to any negative qualities of garlic, but because you truly deserve to feel your absolute best. Your well-being is an ongoing adventure. At this point in life, the aim transcends mere longevity. It's about embracing a life of intelligence, with clear thoughts and a tranquil spirit. What steps should you take? After considering all of this, you may find yourself pondering whether it's time to eliminate garlic from your diet entirely. Is it perilous for all individuals? Is it time to discard the garlic in my kitchen? No, it is not. Garlic is often misunderstood and is not the foe it's made out to be. This remains a potent, natural sustenance that, when utilized thoughtfully, can enhance your well-being. Embrace garlic with admiration, rather than trepidation. As we grow older, our bodies develop heightened sensitivity, the way we digest food evolves, our medications may interact in unexpected ways, and experiences that were once comfortable in our 40s can have a different impact in our 60s or 70s. That is not a sign of frailty. Such is the nature of existence. Our task at this moment is to adapt thoughtfully and with mindfulness. Let's explore a few straightforward and considerate approaches to savor garlic while minimizing any potential concerns. First step. Consult your healthcare provider or pharmacist prior to beginning garlic supplements, or if you are currently using them, reach out to your doctor. Be transparent about all the ingredients you're utilizing, regardless of their natural origins. Take your supplement bottle to your next appointment and inquire, is this safe to use alongside my medications? You might be astonished at how frequently something as natural as garlic can affect your medications. It's wiser to inquire now than to encounter a preventable issue down the line. Phase 2. Incorporate garlic into your meals rather than relying on supplements. Whenever you can, source your garlic from whole foods rather than capsules, oils, or extracts. Incorporating garlic in moderation within a well-rounded meal tends to be a safer choice compared to consuming highly concentrated forms. Supplements offer not only convenience but also a heightened experience. A single garlic pill may hold the potency of multiple raw cloves. That's quite a bit for your body to manage, particularly if you're sensitive or taking medication. Phase 3. Pay attention to the signals your body is sending. Your body possesses great wisdom. If you experience nausea, stomach discomfort, headaches, or any shifts in your feelings after consuming garlic, pay attention to those signals. Maintain a straightforward food diary if you're feeling uncertain. Document what you consumed and your emotional state following the meal. If garlic is involved, you'll notice certain patterns emerging. And if something feels off, it's perfectly fine to take a step back, even if garlic has been a staple in your diet for years. It's perfectly natural for our needs to evolve over time. Fourth step. Get the garlic ready. Softly sautéing garlic can enhance its digestibility for numerous individuals. Consider roasting it, lightly sautéing it in olive oil, or incorporating it into soups where it gradually softens. Crushed or consumed on an empty stomach, raw garlic is much more prone to causing irritation. There's no need to sacrifice taste, it's all about the careful way you welcome it into your life. And remember, you can also cut down the amount. A small amount can make a significant impact. Fifth step. Take a moment to reflect before the procedure. Inform your surgeon or dentist about any garlic supplements you are taking if you have a medical procedure scheduled. It's possible they will request that you cease taking it a week prior to the surgery, similar to the guidance provided for aspirin or other anticoagulants. This minor step has the potential to avert a significant issue, such as excessive bleeding during or following the procedure. This is a straightforward action, yet it holds significant importance for your well-being. Step 6. There's no need to feel remorse for scaling back. Many individuals find themselves compelled to continue using garlic due to its long-standing reputation for health benefits. Keep in mind, wellness is a personal journey. What works for one individual might not work for someone else. If garlic doesn't sit well with you, it's perfectly fine to decline. There's nothing amiss in heeding the signals your body sends you. Numerous other foods can bolster your heart health, enhance digestion, and strengthen your immune system while ensuring you feel comfortable. Step 7. Consider different options. If you appreciate the health advantages of garlic but find it difficult to digest, consult your physician for suitable alternatives. Herbs such as ginger, turmeric, parsley, or even cooked onions provide anti-inflammatory and heart-friendly benefits, all while minimizing strong side effects. A diet abundant in fruits, vegetables, fiber, and lean protein stands as your strongest ally in the battle against disease. No single food or supplement can accomplish everything. Keep in mind that your well-being is a delicate equilibrium. It's a journey of discovery, adaptation, and nurturing oneself with insight and grace. Garlic certainly has its benefits, but prioritizing your health is paramount. There's no reason to dread garlic, but it's essential to be knowledgeable. When you gain deeper understanding, you can make more informed choices. And that's precisely what you're engaging in by viewing this video. You are seizing control, not only of your well-being but also of what lies ahead. Take a moment to inhale deeply, have faith in your intuition, and continue to seek answers. This journey is one you share with others, and each mindful step you take brings you closer to a life filled with strength, longevity, and newfound confidence. As we age, a certain transformation occurs. Life unfolds before us, revealing not just stark contrasts but a rich tapestry of insights, woven together by the passage of time and the lessons it imparts. Our experiences have taught us that solutions are seldom straightforward, and even the long-standing beliefs we hold, such as the value of garlic, warrant reconsideration. However, that is not something to be afraid of. Indeed, it's a cause for celebration. Examining what we consume is not a sign of frailty. That is power. That is bravery. Ultimately, that embodies true understanding. Should there be a singular insight you glean from this video, let it be this. Your well-being encompasses more than merely steering clear of illness. It's about embracing life to the fullest. It's all about having the energy to engage in the activities that bring you joy. Tending to your garden, strolling alongside a friend, enjoying playful moments with your grandchildren, or simply greeting the morning with tranquility in your body and clarity in your thoughts. Such a state of well-being isn't achieved through a single miraculous food. It arises from attuning to your body, your experiences, and your instincts. It arises from the careful, intentional decisions we make each day. It stems from the understanding that it's perfectly acceptable to seek answers, to reconsider your stance, and to prioritize your own well-being. Even if it contradicts what you've been told by others. If you've discovered something new today, I urge you to pass it along. Share it with a friend. Share your thoughts. Share your insights and allow others to gain from the understanding you've acquired. Engaging in open dialogue about these matters fosters safety and resilience within our communities. If you've ever found yourself inundated by the plethora of health advice available, consider this a gentle reminder. It's not necessary to take on every task. Focus on what truly benefits your body, aligns with your current life phase, and nurtures your inner tranquility. I appreciate you taking the time to be with me.